Hello everyone, welcome to our second live, Ask the Vet live. I don't think I had many questions over the week, so feel free to pop some in the comments and I will do my best to answer them. So what I'll probably do today is talk about one of the cases that we had during the week, or a couple of cases actually I'll talk about. So there's one that I vaguely mentioned last week, which was one where a dog came into us for a castration, and on arrival it became very apparent very quickly that he had a really large wound in his inguinal region. And so once we got him on the table, we had a really good look, and it was one of the biggest wounds I think I've ever seen. It was very, very deep, kind of in his inguinal region all the way to sort of inside, and basically the skin and the subcutaneous fat had separated completely from the abdominal musculature all the way up to his sternum. Sorry, the dogs are just getting excited by a cat. Give me 2 seconds. Hey, Sky, come on, out. Out. Come out. Out. Come on. Oh, sorry. Hold on, you can go out too, Louis. Come on. Out. Out. Louis, come. Come on, Louis. Come on. Chop, chop. Go on. Sorry about that. The dogs have all been sleeping so nicely this morning. I thought they would continue for this, but clearly not. So yeah, the skin and the subcut had completely separated from the muscle, and that was basically around the entire abdomen. So that was a lot, obviously. And we spoke to the owner, and we obviously suggested euthanasia because this was a wound that was going to take months and months of treatment, and the dog was going to suffer, and it was going to be something that needed a general anesthetic or at least heavy sedation every day to treat it. And the owner didn't want to do that, so we offered to treat the dog for free here. But the owner was worried, I think, that we would take the dog and put it down anyway. So she took the dog to another vet who didn't have space to keep the dog. So I actually reached out to that vet again today to kind of find out what happened to the dog. And he says he's not sure because she took the dog to him, but then took the dog home. And he's not really heard from her since. And that's been a bit frustrating, I think, this week. Not knowing what happened to the dog, and not being able to kind of help when we had offered everything that we could, and we were, offering to do everything for free. And it's very difficult in those situations because obviously, certainly in the UK, we take an oath when we graduate to always put the welfare of the animal first. But how do you do that when the owner of the animal is refusing sort of to put the welfare of the animal first? And in the UK, we would have the owners sign a kind of against veterinary advice form. But we can't really do that here. So it was quite an interesting one, quite a difficult one for us to kind of try and navigate. And it kind of brought into question the differences between sort of informed consent and ownership and everything like that they have sort of here compared to the UK. Good morning, Catherine. Thank you. I got my hair done on Wednesday, I think it was. My friend's mum owns a salon here, so they very kindly do my hair for me when I need it doing. So yeah, thank you. Do we treat other animals at the clinic? We do. We have we'll pretty much treat any animal that comes in within reason. Obviously, kind of the smaller animals, birds, things like that, generally by the time they come in, they're ill enough that we euthanize them. But we did have a seagull, there was a seagull in a few weeks ago that Oriana treated and released. We have 4 donkeys, I think, at Ashty's that she looks after. And we did do a sort of donkey, it wasn't really a rescue because we didn't keep the donkey, but there was a donkey found at the side of the road a few weeks ago that I went and kind of helped the people, and we found it home and everything like that. So we did that. I think in the past people have treated exotic animals here. I think there's quite a big exotic pet trade here. And so we have treated kind of exotic pets and things like that when they come up. Around us, there's not a huge amount of wildlife, sort of where we live on the rubbish dump, so we don't tend to see too much of that. But obviously, if someone came with, you know, a donkey or a sheep or something like that, we would absolutely treat that as well, as much as we could. I obviously, in the UK, again, a bit of a difference compared to here, you specialise quite early. So I haven't really done any farm animal work or equine work since I graduated. So I can do my best, and I obviously, you know, have transferable skills and I have some knowledge, but Dr. Ali is the one really that does the kind of horses and the farm animal stuff, because that's what he sort of learned most about at uni. So yeah. Hi, Zubaida. I'm good, thank you. I'm a bit tired today, I have to say, but I'm good. And yeah, so if anyone has any questions, good morning, Sue. Hi, Tina. Oh, thanks, Louise. Yeah, I am quite pleased with my hair, which is interesting because they don't often have women with short hair here. So it's a bit of a risk going to the hairdressers and getting them to cut your hair short. And I didn't actually expect him to cut it this short, but it's kind of back to what it was when I had it a while ago, and I do like it. So, yeah, thank you. So, yeah, that was case number 1 that we chatted about. And case number 2 this week has been a big one for us, was Donald. Thank you, Tina. Donald came to us from Baghdad, and he had a diaphragmatic hernia. So that's basically where, and when we looked at the x-rays, it looked like it was a traumatic hernia because there's a bullet in his chest close to his rib cage. And so that bullet had obviously torn a hole in his diaphragm, and his sort of abdominal organs, some of his abdominal organs had gone through that hole into his chest cavity. And that means that his lungs didn't have enough or as much space to kind of fill and things. So it's quite dangerous. Cats can often be born with them, and they can be incidental findings, but you'll often see that they have a bit of a weird breathing pattern. So when Donald came to us a few days ago, he was what we call belly breathing. So a lot of the effort that he used to take breaths in and out was from his abdominal muscles rather than his diaphragm. And so I've never done this surgery before. In the UK, it would be done by a specialist. And so me and Dr. Ali chatted about it, and we decided that I would do the surgery because I tend to be a little bit quicker at the surgery, but Ali is a lot better at the anesthetic side of things, so he would do the anesthetics. And I have to say, I wasn't looking forward to the surgery. It's been quite a hectic couple of weeks. I was tired. I've never done it before. And that's always quite nerve-wracking. So I wasn't looking forward to it. And anyway, on Thursday it was that we did it. We got him all prepped and ready. And the scary part of surgeries like this with kind of patients that are, you know, fairly well in themselves before surgery, but with any kind of what's the word I'm looking for, impairment to their respiratory function, is that they'll just kind of crash under the anesthetic. And Donald, luckily, was very well behaved under the anesthetic. Usually with this kind of surgery, you would have them on a ventilator. We don't have a ventilator, obviously, so Dr. Ali was doing the manual ventilation, and he did very well. And it's obviously a very fine line between underventilating and overventilating. So you don't want to, and also if you're manually ventilating, you run the risk of rupturing the lungs if you ventilate too hard. So Ali was very, very good, and we kept Donald nice and nicely perfused throughout the whole surgery, and we repaired the hernia. Luckily, there weren't too many adhesions or anything like that. So we repaired the hernia, and we even managed to castrate him. And he is currently doing very well. He's very comfortable. He's eating well. He destroyed his bowls of food straight after the surgery. He was obviously very, very hungry. And currently he's doing well, and we're sort of 48 hours post-op now. So I'm feeling positive. And given that I was not looking forward to the surgery and I didn't really want to do it, the feeling afterwards of achievement is really great. And I know that Dr. Ali feels that as well. So that's been a really good thing that we've done this week. And we're both very, very happy, very pleased with ourselves. Richard, of course, please throw in a question. That's what I'm here for. Yeah, what can I help you with? Got my coffee. But yeah, and then we've also got a cat. Whilst I'm waiting for Richard to throw in his question, tell you about another cat that we have, who is got an eye problem. I haven't had a chance to have a proper look at this cat yet, but it looks like it might have microphthalmia, which is where it's born with kind of an underdeveloped eye. And usually they're fine and they don't need anything doing to them, but I think this one might be a little bit infected. So we're going to have a proper look at that one over the next couple of days. She's just kind of playing in her cage right now, and possibly take it out if it is causing an issue. But yeah, we'll see what we find there. Thank you, Ali. You did really well. I was so proud of you. Yeah, it was a good surgery. So yeah, any questions? If Richard fancies asking. Otherwise, there's a little update. I don't know how many of you saw about the puppy that came in, who was dumped in the driveway with her two siblings, who unfortunately died. She's doing really, really well. I'm desperately trying not to keep her. But she's very cute. She's called Harley, and she's doing very well. We've even started some training. She knows how to sit now, which is good. We didn't remove the bullet from Donald's chest, Lou. I considered it, but I didn't want to do too much digging, and I didn't want to extend the surgery time for much longer than we had to. So I didn't do too much digging for the bullet. So yeah, that is still in there. I think possibly something we could look at removing in the future, but also it doesn't seem to be causing an issue currently. So yeah, I think that one we'll just kind of wait and see. And then Bourne is also still with us, Tiddles even. And he's the one with 3 bullets in his chest. Not his chest, his head and his neck. And he's doing very well. He is one of the loudest cats I've ever met. He loves to yell at us constantly. And you think he's yelling for food, and then you give him food, and he eats a couple of mouthfuls and then carries on yelling at you. So it's really nice to have such friendly cats in. I actually struggle to take Donald's respiratory rate and heart rate at the moment, because every time I try he's just purring constantly. So I'm literally just going off the colour of his gums to hope that he's nicely perfused, and his respiratory efforts, which both seem fine. But yeah, sometimes I'm a bit like, oh, if you could just not be so happy, then I could take your vitals a lot better. Yeah. So yeah, if anyone has any questions or any thoughts on anything. We also have Louis the little dog, little land shark. He's doing very well. I'm pretty sure he's got some Mali in him because he's such a mouther and a biter. But he is heading to the UK in January, which is exciting. And what else is going on in the shelter at the moment? So we've got the 3 cats. Bryn is very good. He just had his bath and his skin is looking so much better. It's looking so much less irritated. So he's looking a lot more comfortable, all eating and drinking fine and everything. And he's such a sweet little boy. But yeah, he's looking a lot better. His skin is looking a lot better. It was my first diaphragmatic hernia repair, actually. Yeah, it's not really a surgery that I would do as a sort of first opinion vet, I don't think, in the UK. Certainly not in any of my practices. Yeah. So yeah, I was very proud of myself, and of Ali, and of the team. I feel like Bryn may end up going home with you, Louise, I have to say. I think you're possibly going to end up with another 2 dogs if you keep Elsa. I think you'll probably end up with Bryn as well. But I can't talk because I'm currently trying to not adopt Harley. But she's looking very cute at the moment, curled up by the door. Let me show you. There she is, looking very adorable. And we'll show you all Donald as well, actually. This is Harley. And this is Tiddles. Getting annoyed at us. And Donald, looking very comfortable, very happy. Kept his Primapore on from when we removed the chest drain, which is nice. And you can see, if he'll let me, how nice and pink he is. And yeah, purring. Oh, Vienne is definitely deserves a home. She's moved up to section 2 with Andromeda and Rosalie. And they're doing well. They're doing really well. I do miss her. She never really caused problems until she got in with Rosalie and Andromeda, and then they kind of formed this little trio that didn't really like people or dogs. And so she's up there now, but she really deserves a home. She's so sweet, and she has this, for anyone who doesn't know Vienne, she was a distemper survivor, so she's got this continual kind of bouncing twitch that she does, which is sort of a remnant neurological symptom that she's got. And it's very cute to watch, and she's really, really sweet. And so if anyone is looking for a dog, she is a real beauty, and just so sweet. But yeah, she definitely loves Rosalie. And Rosalie is not the biggest fan of other dogs. So yeah, they liked to keep us on our toes when they were in airlock. But yeah, now Gara and Zada get a bit more time out, and Togo gets a bit of a bigger cage, because we sort of moved Rosalie and Andromeda and Vienne up to section 2, and then we moved Zada down to airlock, and Zada and Gara kind of spend most of the days out, which means Togo gets the front bit of their kennel as well, which is nice. Francine, I'm not sure what you mean where at. Yeah, if you could elaborate, I can answer any questions you have. Oh, thank you, Louise. Yes, Dr. Zubaydah was there as well. She was very, very helpful, and I hope she found it informative as well. And she was here yesterday actually, and she did amazingly. We had a really, really busy day yesterday, and I was very worried that I was going to be here till about 10 p.m. But she really helped speed things up, and we smashed it. We did really well, so I was quite pleased with us yesterday as well. Yeah, so trying to think what else is going on. I think possibly Katie, one of our Section 5 dogs who's been here for a long time, who's also one of my favourites. She's very similar in personality to Sky, but a little bit less confident. And I think she might have a foster home in the UK, so that's really exciting for her because I've been trying to get her out for a while. So that's really exciting for her. I'm very pleased with that. And then we've got those, and I did a nice walk around the shelter a couple of days ago, sort of around the perimeter and everything, and Sia and Rasha are doing really well. They're kind of up at the top corner next to Section 5, just outside, and they're very happy with their freedom, and they're a lot more friendly now. They actually come up to you for cuddles now that they have the option of running away if they want to. And Kojo is also outside, and he's doing really, really well. The three puppies, Susan, Sapphire and Tramp, they're out front next to the front gate. They seem to have settled. They kept fighting, and they seem to have settled now, which is nice. We're not having them all in all the time with bite wounds, so that's good. And Bahadur is doing really well. He's a lot more steady on his feet. He's still got a little bit of a wobble, but he's a lot more steady on his feet. Butterfly as well. So Bahadur and Butterfly are two of our dogs outside who have long-term meds, which is quite a new thing we've started doing because previously it was quite difficult to medicate dogs outside. But these two are always kind of just outside the front gate, so they're quite easy, and they're doing really well. Butterfly is ruling the roost and being in charge and keeping everyone in check and moving around, running around as if there's no pain, and he can use all four legs, which he actually can't. He's kind of hopping around on three at the moment because one of them is has quite severe arthritis, so that's why he's on the pain meds. But yeah, he's doing really well. And trying to think what else we can chat about if no one has any questions. We can go see some airlock dogs, I think. That'd be nice. Yeah, let me change this. This is Harley with her little octopus. She's really smart. I sort of made this little pen for her to train her to kind of, chill out and things like that. And she will get out of it no matter what you do. I did kind of attach it to this door so that she couldn't squeeze through this bit, but she ended up just being able to jump out of it. So yeah, she's very smart and very, very determined. Oh, it was lovely to have you on the live, Catherine. Thank you so much. And I hope you enjoy your walk with the dogs and you go somewhere fun. We'll just say hi to a couple of the outside dogs before we sign off as well. Here's Rumble. Hey. And Sky. Oh, and then if I turn this around, we got Louis. Louis giving kisses. And then we have, oh, it's sunny. It's lovely and warm. Oh, okay, Louis. And then here we have Gara, who is enjoying one of our raised beds. Hey, all right, Sky. And Lalita, some of you might remember Lalita. We did a mucocele surgery on her quite a while ago now. And the lump has returned, but she's doing fine in herself, so we're just kind of leaving her and seeing how it goes at the moment. And she enjoys being an inside dog. The wind farm, do you mean the solar farm, Jane? I think it's going well. We had a bit of an issue. We got delivered 3 smashed, this is Zada, also sunbathing. We got 3 smashed solar panels delivered, so I think we're kind of trying to figure that out, and get them sent back and replaced and everything. What sort of home does King Louis need? He needs an active home, Lou. He definitely needs an active home, and one that's able to put in some fairly consistent and firm boundaries to stop the mouthing, because he's very Mally-like in his ability to just keep jumping up at you and mouthing, but he's also just very adorable. And yeah, Louise has found a home for him, so he's gonna he's gonna be living near, I think next door to Louise actually. Yeah. Him and Harley very much enjoy running around the clinic causing chaos, so they're only allowed to be together for short periods of time. He's honestly one of the most mouthy dogs I've ever met, but very sweet. And actually is learning inhibition, so he's learning not to bite too hard, which is good. So yeah. But anyway, if there are no other questions, I will sign off for the day, and I'll leave you with the view of the airlock dogs. This is Louis' favourite game. I need to get him one of those, almost like a piñata. Limpy's doing well. Where is he at the moment? Oh, here he is. He's been hiding. He's in the shade. Louis. Yeah. He's doing good. He's been sleeping in the comfy beds every night in the office cage. Are there any dogs that I think would be particularly suited to a home and especially deserving? Oh, so many of them. Well, now that Katie's gone, I think Billy is one that I would like to get in a home. Although Billy does seem quite happy as an airlock dog here. So the next one I think would be Akira, and I think I might be able to have enough internet to show you. So Akira, I think, has been fostered out 3 times, but returned to us because she's so active. Where is she? This one. This little husky cross. So she's quite overweight in the clinic because she doesn't get the exercise she needs. But she would make an amazing hiking dog or mountaineering dog for someone. She would just love it. She would absolutely love it. And yeah, so it would be nice to kind of try and get her out a bit. But yeah, I'm very happy that Katie's got a home, and I think Billy is probably the next one that we're going to focus on, unless obviously we get any little dogs that need to be taken away from all the big dogs. But yeah, so it was great talking to you guys again. I'm gonna sign off, and Richard, if you want to just kind of send us a message with your question, I'm happy to either answer it next week, or I can send you a message or something like that. So yeah, thank you so much for joining, everyone, and I will see you all same time next week. Thank you.